Tumors are defined as the abnormal growth and development of cells. When this development occurs in the brain, it's referred to as a brain tumor. The brain is an organ enclosed within the protective coating of our skull or head, making injuries to the brain relatively rare. However, if brain cells are exposed to radiations like X-rays, mutations can occur within the DNA of the cells, leading to the formation of tumors. Additionally, hereditary problems transferred from parents to offspring can also cause brain tumors. Treatment methods for brain tumors include surgery, chemotherapy, or radiation therapy. There are several surgical techniques. 1. Craniotomy. This is the most commonly performed surgery for brain tumors. The neurosurgeon conducts medical tests like MRI to locate the exact position of the tumor. During the surgery, a cut is made in the patient's scalp, and the bone is removed to access the brain cells. Nowadays, a tubular retractor system is also used during craniotomy, which moves through the white matter, gently pushing brain tissues aside without damaging them. This makes access to the tumor easier and allows for its removal. Craniotomy is also performed to remove blood clots and treat skull fractures. 2. Neuroendoscopy. In this method, 2 to 3 small holes are made in the skull, and with the aid of a neuroendoscope, the tumor is located and removed. For some tumors like pituitary tumors or pineal tumors, accessing them through the skull is difficult. Hence, in such cases, neuroendoscopy is done through the nose or mouth. 3. Laser ablation. This is another method to treat brain tumors. Laser ablation is a procedure where a thin laser probe is inserted into the brain. Using light and heat, it locates and eradicates the tumor.